All right. Well, I'm Bixby Marino Kibbe. I'm the clinic director for the Center for Gender-Affirming Care. And we're so excited to be able to have this time with you, Adam, to talk more about the work that we do. And so excited to partner with you about figuring out ways that we can kind of expand the care that's available.
Absolutely. Same here. Very excited.
And I'm Dr. David Edwards Breland. You could call me Dr. David. I have a hyphenated name. I got married a couple of years ago. And I'm excited. I'm one of the newbies in the clinic. I'm so excited that they hired me as one of the co-medical directors. I started the gender clinic up in Seattle. And so I've been doing gender care for 12 years. And
Wow.
You just saw why I do what I do. That's why I do what I do. I'm an adolescent medicine specialist. I'm a pediatrician, but I did 3 more years of training to work with adolescents. And to be an adolescent advocate is to do what I'm doing now, is to helping affirm and creating happy, healthy adults, which we're doing.
I'm so inspired by those who we just talked to. I mean, it's gorgeous, you know. What I got from it mainly was just that this is a safe space to get answers, to get support. I mean, the fact that parents can come as well. I mean, what a blessing this is. It's really beautiful.
So it's really one of the designs of our clinic that we, think is so important is we're really a family systems approach to care. So we recognize that all of these young people live in families, and that when a young person comes out about their gender identity and decides to take steps on a gender journey, that happens in the context of family. And if we don't take the time to really hear parents and create also a safe and non-judgmental space for parents to kind of talk about what they're going through, we're not going to really help kids. And so it's so important for us, for parents to be able to come in, be able to talk with other parents, be able to get their questions answered, not to feel like we're not automatically categorizing them as supportive or unsupportive. I think really helps ensure that these kids are going to be able to have a long supported journey.
And then when I add in the kind of the medical piece, it demystifies what hormones could do. And there's a lot of worry that long-lasting effects, etc. Yeah, they're there, but I think I'm able to explain, and we are all able to explain it to a point where patients and parents understand the ramifications, if there is any, and really to move forward. What really touched me is the fact that sometimes I know I'm an African American doctor, male doctor, but the fact that I was able to walk into a room and I affirmed those 2 individuals on multiple levels, that is kind of my purpose of being a doctor. And I'm not getting emotional, but I am, because it's just amazing. And I've heard some things that are amazing to hear, that they feel that it's a home base. And I think we need to make it even more so for all adolescents, and particularly the gender diverse youth. We share space with adolescent medicine, so we have other faculty that do adolescent medicine, and then I do gender care, and one of the endocrinologists, or 2 of the endocrinologists, do gender care, and we collaborate, talk. In the clinic, it's almost like a one-stop shop. We're able to assess and screen for depression, anxiety. If they're having sex, we could screen them for STIs. We could put them on birth control. We can stop periods. One day we're going to be able to prescribe PrEP. We want to be that kind of one-stop shop for these young people.
Yeah, that's brilliant. I was curious about how that plays into it, because obviously we know now that gender and sexuality are very different things and not always mutually exclusive. And I'm sure that you encounter a lot of that with your patients, is how to integrate those 2 topics together, and how to explain to parents that they're not the same thing. Because I know that probably a lot of parents get confused as to where the line is.
They do. Yeah. Sometimes visuals are very important. Have you heard of the gender unicorn?
No, but I'd love to hear about that.
Oh, you got to Google it. The gender unicorn is something that was created by transgender non-binary youth to kind of look at the spectrum of sexuality, gender, romantic attraction, biologic differences, things like that. And sometimes that is a visual cue, is something that really brings parents to like, oh, it is different, you know? But yeah, really piecing out how it is different is really enlightening for parents.
Yeah. And I was saying earlier, I think one of the things that's so wild is even within the LGBTQ community, we're learning, you know, we're learning right along. There's so much to understand, you know, and, you know, because discrimination exists in the mainstream world and it also exists within our own community. And that is something that I'm very aware of, that I'm really hoping that the foundation can look at as well.
For sure. For sure. I end up really educating, you know, my fellow gay and lesbian and bisexual friends about, you know, just the simple things of like pronouns, how important they are, and how important it is to not downplay pronouns. And if it's a pronoun that doesn't seem to fit in your English vocabulary, that's okay. Just work with it. You know,
just try.
Try. And I've had many conversations around that with our community.
Yeah, no, same. I mean, I think a lot of people's egos prevent them from making the change, you know, and I think that's the hard, especially as Americans, where as a society, everybody's very, you know, it's hard to tell someone to do something differently or that what they were doing isn't working for somebody else, you know. But I think that's where we're at. We're at a very interesting time in our culture where the trans experience is a great example of being aware of and supporting your neighbor, your, you know, member of the community. It's not all about you, you know. But it is, I think there's a reckoning happening right now for sure. And I'm just so glad that your center exists, because I think so much of the education and the awareness of the trans movement is via social media, for example, which is a great tool. It's a great way for us to learn about it and to be introduced to trans people. But the fact that there's an actual medical side piece to this that helps people reach their goals, I think is wonderful. It's great.
I think we know, so I spent a long time working with trans and non-binary, actually LGBTQ adults through the local LGBT center. And I think one of the things that's really a common experience among LGBTQ adults, but specifically trans and non-binary adults, is this discomfort with accessing healthcare and this kind of assumption that you're going to go into your healthcare provider and they're not going to understand how to meet your basic needs, and that it's going to be a terrible experience. And I think our biggest goal with this clinic is for these young people to turn into young adults who are not afraid to access healthcare and who can really take care of their preventative healthcare needs. That's just the basic, you know, kind of lowest bar that we can have for people, is to be able to just take care of their bodies, and to know that you can see a doctor who understands and who's not going to judge you and who's going to ask you the right questions and meet your needs.
And does some of that advice come from just helping guide where the right doctors are and who they are?
I think it comes from these young people being able to come into our clinic and have a positive experience. I think that tells them that it's possible, and that and that the doctor's office doesn't have to be terrible. So we spend a lot of time talking about, you know, what are the things that are triggering for you in a healthcare setting and how can we mitigate those things? Being trauma informed is so important to us. So, you know, whether it's just altering the way that we talk with a patient or making it so that they don't need to wear a gown if that's not something necessary. Those are little things that make a huge impact on whether this young person is going to come back for care.
And another job that we have is to educate community physicians, because my main thing is, I think what we do could easily fit into primary care. Patients should feel comfortable wherever they seek care. And so to expand our knowledge and have it propagate into community practices where patients can come out with their primary care doctor and feel affirmed. That's one thing that I think we are struggling with, but we are really trying to educate and teach.
That's amazing. And how exactly do you go about that? I mean, this center is within the Children's Hospital, correct? I mean, it's within a bigger, so, or do you find yourself interacting with some of the other staff in the other departments and having conversations? I mean, where does that come in?
Yeah, conversations. Also, patients are, other specialists are referring patients to us. And then they, we write notes and they get my note. They see how I refer to the patient.
Mm-hmm.
I've had, since I've been here, I got here April 15th. And since I've been here, I've had a few faculty reach out to me to say, oh, I have a niece or I have a cousin that I have some questions about. Can I talk to you? So it really propagates that way. And then the other thing is to go out and educate and teach. So I give something called Grand Rounds, which is a educational hour that community pediatricians will tune in to or attend. I will work at other kind of continuing medical education areas to continue to advocate to at least the pronouns and names being something that you have to do. So teaching, and the other thing is, I would say that BICS, has been a ambassador, and I think they have been here so long that they've really put a great mark on gender-affirming care for Rady's. And so when they, when I bring up, oh, BICS, oh, I like them, they're great, it just normalizes it. It normalizes that we are all human. We're providing medical care. We're providing guidance. You could do the same.
Wow.
I think it's been really important, as an out kind of trans non-binary person, to be able to demystify that divide, that we can be part of the community and be providers and be professionals. And a lot of the education and training that I do is going around and talking with other providers about what it's like as a trans person to be in a doctor's office. And so sometimes that includes like live coaching, where I'll shadow an appointment and I'll share with them, when you use this language, sometimes that may be bring up anxiety, or I think there are a lot of things that if it's not your lived experience, you don't think about, and that's just part of privilege, and that's part of how it is. So I think that's been really effective, and there are a lot of providers who really they don't learn about trans healthcare in medical school or in nursing school, and they really want to serve their patients well, but without that education, they don't know what they don't know. So we do a lot of in-services, a lot of coaching, a lot of just sharing lived experience.
And we also have medical students and residents rotate through our clinic. So they are having they're having exposure early. And so probably 5-10 years from now, there will be a crop of primary care doctors that feel comfortable keeping some of their patients and helping to transition them. So that's another thing that we're doing to educate.
Can I ask you guys a question? With parents, if a parent has a child who's expressing that they're feeling like their gender is not quite what they want it to be, or they're exploring this topic, what would be your first sort of set of advice comments to a parent? What are the kind of the basic do's and don'ts, like a top 5, so to speak? I know if any of my fans are watching this that are out there that might be, a parent of a child, I know it could probably be overwhelming or confusing. So
I would say listen to try to understand. So listen, not to try to undermine what your child is saying to you, but to try to really understand where they're coming from and what it's like for them. So much of gender identity development is about exploration, and exploration is so healthy. And so allowing kids to do things like changing names and pronouns, trying on different clothing and different hairstyles. Sometimes that's the only way that we know if something fits or it doesn't fit, is to be able to go through that process. And I think sometimes parents get so worried about steps that may or may not be part of their child's life 10 years down the road, when really what their child is needing is that safe space right now to kind of explore what they need to explore.
I think the only thing that I would add is that I explain to families and make it clear that they love their child, that their love for their child will allow for them to listen and learn. I often thank the parents when I meet them for the first time. Thank you for bringing your child, your kid, your youth here. That took a lot. You may not totally understand everything, but I know you love your child, and that just really validates them, and that they're trying. It's a process, but they're trying.
Yeah.
I would also say connect with other parents. Sometimes there's nothing like being able to talk to another parent who's been on this journey, maybe years ahead of you. It's really difficult when you're not expecting this information from your child, and when you don't feel like you know what to do. It's hard to see what several years down the road can look like. But talking to other parents can kind of give you some insight into what it can be like to kind of support your child through this journey.
The last thing would be not to believe everything on the internet.
Woo!
Fact check.
Fact
check. Fact check. Talk to your doctor. If they don't know, they know us. Put them in contact with us. Because oftentimes I do a lot of myth busting for parents. You know, there's a lot of myths around transition and hormones that I make it clear that it's not true, or it's not medically possible, or no, that doesn't happen. So I would add that.
Yeah. Are there any any online groups for parents or children out there that don't have direct access to a center like Rady's? Is there anything out there, like resource-wise, that you would recommend? A chat group, page, anything like that?
I often send families to genderspectrum.org. It's an online community that has online support groups, kind of chat functions for both young people and for parents.
Great.
Sometimes kids aren't ready to go to an in-person group, and parents sometimes aren't either. So it's a space where you can get accurate information, but also connect to other people.
Yeah, and I think the local organization Trans Family Support Services is a great, it's not really online, but it's a great way for parents to reach other parents, and also talk to the executive director of that organization who has a trans identified son.
Great.
It just makes it real. It makes it something that's palatable and approachable. So yeah. I would say that. And then, one thing, adolescents, they often have communities, online communities, anime communities, cosplay communities that they get support from. And oftentimes that's where they identify, like, hey, I think I may be trans, in some of these communities. So I think there's those communities that are supportive that a lot of people don't really know about.
Thank you both so much for all this information. I'm so inspired, and I want to, it's like now I want to go to those two sites. I want to learn more. I hope that this is the beginning of a relationship with you guys. It's gorgeous what you're doing. It's really, really wonderful. Thank you so much. Thank you. Thank you. And I'm excited to share this with everybody, because I think it's a new world. We're in a new era with all this conversation. And I think more and more young people are discovering their identity, their true identity earlier now, and they're not having to hide from it, which is so beautiful. So thank you so much.
You're welcome.
Thank you. Yeah, we appreciate you, your willingness to use your platform and to reach people that, we don't always reach with this message.
Absolutely.
And we're always here if you have other questions. We're always here.
Awesome. Awesome. Well, I hope to come visit in person too at some point soon.
We would love it.
For sure.
Yeah. Amazing. Thank you so much, both of you. Thank you for your time.
Of course.
And I hope it's the beginning of a beautiful friendship.
Yeah, for sure.
Thank you.
Thank you.
Thanks, guys. Cheers.
Bye.
Bye.